Come in.
Hi, my name is Madison. I'm a UTEP nursing student. I'm gonna wash my hands real quick. Okay, can I check your wristband?
Yes.
Can I get your name,
Haley Wilson,
date of birth,
6/4/99.
and what you're in for today?
Just a regular checkup.
Okay, well, we're gonna do a head-to-toe assessment. I'm gonna ask you a couple questions before we get started. So, do you have any allergies?
I do. I'm allergic to pineapple.
What happens when you eat pineapple?
I just get blisters within my mouth and I get hives.
Do you know at what age that first started?
It was elementary school, I think.
Have you ever been hospitalized because of it?
No.
How do you normally treat it if you have?
I'll take a Benadryl and it usually goes away within a few hours.
Okay, perfect. So, are you working or are you a student?
I'm a student right now.
Okay, can I ask your ethnicity?
I'm white.
Can I ask your race?
White.
Okay. So, are there any religious things I need to know about?
No, we're all good.
Okay. So, I want to let you know that this whole assessment is confidential, but if I do come up with anything that's touchy, I will have to report that, such as abuse and things like that.
Okay.
So, can you tell me about your support system?
I have a really good family and then my boyfriend as well.
So, if you're stressed or anything, you can talk to them.
Yes.
Okay. Do you have an advance directive by chance?
I do.
You do?
Mm-hmm.
Okay. And, all right, we'll get started. Okay, so I'm going to start taking your vitals, but before, can I see if you know what today's date is?
Yes, it's the 23rd.
Okay, do you know where you are?
I'm at Shadow Health Hospital.
Okay, and do you know what time it is?
Right now it's about 5:30.
Okay, perfect. So I'm going to say 3 words, and I want you to repeat them back to me, but let me say all 3 of them first.
Mm-hmm.
Cookie, bed frame, cup.
Cookie, bed frame, cup.
Okay, I'm going to ask you those words in 10 minutes from now and see if you can remember them.
Okay.
All right, so we're going to start doing vitals. Can I get your height and weight first? So
Yes.
come with me. We're going to measure you. Okay, 5'5". Can you step on the scale, please? Okay, 130, perfect. I'm going to get your temperature if you want to have a seat again.
Yes.
Okay, 98.6, that's normal. All right, I'm going to go ahead and get your pulse, and then we're going to do your blood pressure and all that.
Okay.
So, okay, so your pulse is 82, which is a little high. Are you excited about anything?
No.
Okay, and your respirations are 16.
Okay.
All right, so we're gonna go ahead and do your blood pressure. I'm gonna pump up the cuff twice. The first time I pump it up, it's just to get a baseline. The second, we're actually gonna be taking your blood pressure.
Okay.
I'm gonna have your arm at your heart level. Okay. Come on through. That's loose. Okay. All right. So. Okay. I'm gonna give you a minute, and then we're gonna go ahead and actually take your blood pressure.
Okay.
Okay. All right. Okay. 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 176. So you're good. All right. Thank you so much. Okay. So do you remember those 3 words I asked you earlier?
Yes, it was cookie, bed frame, cup.
Perfect. So now I'm going to start checking your skin, hair, and nails.
Okay.
I'm going to palpate your scalp for any new lesions. You tell me if you felt any new pain, anything like that. Have you experienced any new tenderness or lesions or anything?
No.
Can you tell me about your diet and exercise?
Yes, so I eat 3 meals regularly, and then I go to the gym every day after class for about an hour or 2.
Okay. So everything looks fine. Have you noticed any new moles on your skin or tenderness?
No, not that I'm aware of.
Any changes in moles that you already have?
No.
Okay. Can you tell me, do you suntan?
I do.
Okay, how often do you do that?
I do go out maybe like for an hour every day, just try to get a little bit more tan, but I do wear sunscreen and everything.
Okay, perfect. Have you ever had a history of skin cancer?
No.
Has anyone in your family had a history of skin cancer?
No.
Okay. So now I'm going to check your fingernails for capillary refill.
Okay.
So I'm just going to squeeze each one. Make sure they turn back to red or pink. Okay. How often do you drink water?
I do throughout the day. I haven't been as good as I used to, just because like with school and everything, sometimes I forget to eat, drink.
Okay. So your skin feels a normal temperature. I'm going to check your skin turgor over your clavicle real quick. So I'm going to just pinch a little bit here. Make sure that skin comes back. Okay. Now we're going to check for clubbing. So on each finger, I want you to go like this. And I'm going to try and see if I can see through each nail. So you're going to stick each thumb together like that. Thank you. All right, next finger. Next finger. All right. Okay. So now I'm going to check your pressure points just to make sure everything's good. So do you mind lying back a little bit for me?
Yes.
Okay. So the heels of your feet look good. While I'm down here, I'm going to check for any edema or anything like that.
Okay.
Your legs feel good, normal temperature. Okay. Can I check your hips? Can you roll to the side for me? Thank you. Thank you. You haven't felt anything on your head, right?
No.
Okay. Perfect. All right. Thank you so much. For this part of the assessment, I'm going to be checking your cranial nerves. So you have 12. We're going to do a series of tests. But the first one's going to test your sense of smell. So I'm going to have you close your eyes. I'm going to put a scent under your nose. You let me know what it smells like.
Okay.
Okay, so you can close your eyes for me. Okay. Can you tell me what that smells like?
That's an alcohol swab?
Yes, thank you. All right, so the next is going to be your visual acuity and your peripheral vision. So I'm going to have you stand and read the Snelling chart from me. You're going to be 20 feet away.
Okay.
Can you cover one eye for me?
Yes.
All right, and read that line for me.
A, B, C, E.
Can you read the next line for me?
D, E, B, T.
And the last line for me?
C, A, B, C.
You go ahead and switch eyes and we'll do it again. Can you read that line for me?
A, B, C, T.
The next line for me?
B, W, C, E.
And the last line for me?
A, Z, P, B.
Okay, so while you're standing, I'm going to go ahead and check your peripheral vision. By the way, 20/20, you're good.
Okay.
So I'm going to stand behind you. You're going to see my pen light. I'm going to come to your sides. Once you're able to see my pen light, that's what we're checking. So keep your vision straight and you let me know when you can see it off the side.
Okay.
Okay. So let me know when you can see my pen light.
I can see it.
Okay. Other side.
I can see it.
Perfect. All right, you can have a seat. So now we're going to check your third cranial nerve. So what you're going to do is I'm going to stand in front of you. I'm going to move my pen light around. You're going to follow it with your eyes. Don't move your head, just your eyes. We're going to check your eye movement.
Okay.
So go ahead. Okay. Okay. All right. Perfect. No jaggedness, no weirdness. All right. So now we're going to check your fifth cranial nerve. So this is a series of 3 tests. So first, I'm going to try and touch your eye with a cotton swab. Don't freak out.
Okay.
You'll be fine. Okay. All right, there we go. All right. The next one, I'm going to touch your different parts of your face with a sharp and a dull object, and you're going to let me know what you feel, if it's sharp or if it's dull.
Okay.
I'll let you feel what it feels like first on your arm. So the sharp one's going to feel like that,
Okay.
and the dull one's going to feel like that.
Okay.
Okay, so you can have your eyes closed for me.
Mhm.
What do you feel?
Sharp.
Okay. What do you feel?
Soft.
What do you feel?
Sharp.
What do you feel?
Soft.
What do you feel?
Soft.
Last one.
Sharp.
Okay, perfect. And lastly, I'm going to check your jaw. So I'm going to hold right here. Can you go ahead and clench your jaw for me? Okay, one more time. All right. Can you open your jaw for me as well? All right, perfect. Can you open your jaw against resistance? Yes. All right. Can you move your jaw forward? Perfect. All right. And lastly, we're going to check your hearing. So can you stand for me?
Yes.
Okay. So I'm going to stand behind you and whisper something into your ear. You're going to let me know if you can hear it. Cover the left ear for me and I'm going to whisper into your right.
Okay.
Okay.
You have long hair. Your clothes are blue.
Okay. And real quick, if you have a seat for me, I almost missed one. I'm gonna check your facial nerves. So can you make can you smile for me? Can you frown for me? All right. I'm gonna have you eat 2 things. You're gonna tell me if it's salty or if it's bitter.
Okay.
Okay, so you can close your eyes for me.
Mm-hmm.
Give me your hand. All right, go ahead and eat that and tell me what you taste.
It's salty.
All right, and the next one, tell me what it tastes like.
It's bitter.
Okay, perfect, thank you. Okay, so now I'm gonna be assessing your cranial nerve 9. So what I'm gonna have you do is this kind of your swallowing, your gagging, and all that other stuff.
Okay.
So I'm gonna give you something to drink and I'm gonna have you swallow. Let me see. Okay, does anything hurt?
No,
Discomfort? Difficult?
Nope.
Okay. So next, I'm gonna have you open your mouth for me and say ah. Stick your tongue out. And then say it. One more time. Okay, great. And then I'm going to stick this down your throat, and it's gonna make you gag, but it's just to make sure everything's intact.
Okay.
Okay, perfect. Sorry, I know that's uncomfortable. Okay, so now we're gonna test number 11. So this is just your neck and spinal cord. So can you lift your shoulders for me? Okay. Can you do it against resistance? All right. Can you turn your head to the side? To the other side. Up, down. Okay, so now we're gonna do it against resistance. Can you turn your head to that way? And the other way? Okay, perfect, thank you. Okay, so the last cranial nerve we're gonna be assessing is number 12, and this is just your tongue movement and tongue strength. So we're gonna do a couple of mouth stuff. Not me saying that.
I actually thought that one was good.
Mouth stuff. Okay. All right. So lastly, we're going to be assessing cranial nerve 12, which is just your tongue movement and strength.
Okay.
So can I have you open your mouth and stick your tongue out for me? All right, good. Everything looks like in line and symmetrical. Can you push your tongue against your cheek? The other cheek. Okay, can you do it against resistance? Push against this hand. Push against that hand. Can you open your mouth one more time? Can you lift your tongue and lower it back down? Okay, do you have any pain whenever you move anything in your mouth?
No.
Okay, so can you say the words light, tight, dynamite?
Light, tight, dynamite.
Ooh, one more time.
Light, tight, dynamite.
Thank you. Okay, so now I'm going to be assessing your head and your neck. I'm going to go ahead and palpate your temporal arteries. Okay. Can you tell me about your dental hygiene?
It's good.
When was the last time you went to the dentist?
Maybe like 2 months ago.
Okay. Okay, everything looks nice and symmetrical. Nothing out of the ordinary. Have you noticed any tenderness in your face?
No.
Redness? Itching? Pain?
No.
Okay, so I'm going to go ahead and run my hand down your trachea, just so you know it can tickle some people.
Okay.
Okay. All right, so now I'm going to palpate your lymph nodes.
Okay.
So you got your occipital, your postauricular, your preauricular, your tonsillar, posterior cervical, anterior cervical, submaxillary, submental, and supraclavicular. All right, did any of that hurt? Any tenderness?
No.
Anything like that? No discomfort? Okay, lastly, I'm going to check your jugular vein. I'm going to have you lay at a 45-degree angle for me. Lie back. Thank you. Can you look to your left, please? And up. Thank you. All right. So, pulse is under 3 centimeters. Nothing coming out too far or too long. All right. Thank you so much. Everything looks normal. So now I'm going to be assessing your eyes. Have you noticed any redness?
No.
Itching?
Just whenever I have allergies, like seasonal allergies.
And how do you usually treat that?
Usually it goes away by itself. If it's really bad that day, I'll maybe do a Benadryl.
Okay. Have you noticed any discharge?
No.
Okay. Can you pull down your eyelid for me? Thank you. The other one? Have you noticed any blurry vision?
No.
Okay. So now I'm going to check your pupil's reaction to light.
Okay.
So go ahead and look at me, and I'm going to shine a light in your eye. Okay. Okay. So now I'm going to test your accommodation. Can you look at that picture back there? Okay. Can you look at my pen light? One more time. Okay. And then I want you to follow my pen light with your eyes.
Okay.
Just your eyes. Okay. Perfect. All right. Now I want to assess your cardinal light. So you're going to look at me, and I'm going to shine a light in your eye. We're going to see if it hits in the same spot on each. Okay. Perfect. Okay. So now I'm going to assess your ears. I see your ears are pierced. Did they heal properly? Everything's good?
Yes.
Any tenderness?
No.
Pain?
Mm-mm.
Discharge?
Nope.
Achiness or anything like that? Balance issues?
No.
Okay, so I'm gonna go ahead and palpate your ears. Let me know if anything hurts at any point.
Okay.
Okay. Any ringing in your ears?
No.
Nothing like that. Okay, so now I'm gonna assess your hearing. We're gonna use a tuning fork. I'm gonna hold it behind your ear, and you're gonna let me know when you can no longer hear.
Okay.
Okay.
Do you want me to stand up or anything?
No, it's fine. You can do it sitting. Okay. Let me know when you can't hear anymore.
I can't hear it.
Okay. Let me know when you can't hear anymore.
I can't hear it.
Okay. Other side. Let me know when you can't hear anymore.
I can't hear it.
Okay. And let me know when you can't hear anymore.
I can't hear it.
Okay, perfect. So your air connection is longer than your lung connection. And one more test. I'm gonna do it again, but this time you're gonna let me know if you hear it equally on both sides.
Okay.
Okay.
Yes.
Okay, perfect. Lastly, I'm gonna assess your nose. Have you had any congestion?
No.
Runniness?
Nope.
Bleeding?
Mm-mm.
Pain?
Nope.
Okay, I'm gonna palpate real quick. Let me know if this hurts at any point.
No.
Okay, and I'm looking at your nose real quick. Okay, no polyps, no septal deviation. Perfect. Any itching?
No.
Okay, perfect, thank you.
Mm-hmm.
Okay, so now I'm gonna be assessing your lungs and your respiratory system. So first I'm just gonna be looking. Your AP ratio looks normal, but I'm gonna palpate and make sure. I'm not saying any barreling or anything like that. Okay. Your AP ratio is 1 to 2, so that's good. All right, have you noticed any new moles or lesions?
No.
Difficulty breathing?
Nope.
Wheezing?
Mm-mm.
Coughing?
Mm-mm.
Sputum or cough up any mucus or anything like that?
No, just when my allergies are bad, but it's very rare.
Okay. How do you treat that if you have a cough or anything like that?
The same thing, just a Benadryl.
Okay, all right. So everything looks nice and good. I'm gonna test your chest expansion. Can I have you turn your back to me?
Mm-hmm.
All right. So can you take a deep breath in and out, and one more time. All right, chest expansion looks good. Now I'm gonna also tape for lung sounds.
Okay.
All right, so each time I put my stethoscope on you, I want you to take a full deep breath in and out. And then I'm gonna clean it off real quick, okay? All right, so here we're gonna be hearing bronchial sounds. So deep breath in, deep breath out, one more time. So now we'll be looking for bronchovesicular sounds, one more time. Sorry, one more time. One more time. And one more time. All right, I'm gonna be going under your shirt now. Is that okay with you?
Yes.
Okay. So now we're gonna be hearing vesicular sounds one more time. All right. One more time. All right, I'm gonna go under. One more time. And last time in the front. All right, I'll give you a break and we're gonna do your back.
Okay.
Back side. It's a lot of breathing. All right. All right, every time I touch you, full respiration, in and out. All right. Again, bronchial sounds. Sorry, one more time. All right. Full in, full out. Full in, full out. Full in, full out. And last one, full in, full out. Okay, so no pain or anything like that?
No.
No discomfort. All right, thank you so much.
Mm-hmm.
Now I'm gonna be assessing your cardiovascular system. Real quick, have you had any difficulty breathing?
No.
Chest pain?
Nope.
Difficulty breathing when you're laying down?
Mm-mm.
Okay, so I'm gonna go ahead and palpate some arteries and then we're gonna listen to your heart.
Okay.
Okay, so first your carotid. All right, everything sounds good and feels good, +2. Everything feels good here too. All right, your apical one, I'm gonna have to go under your boob, if that's okay.
Yeah.
Okay, so now I'm gonna do palpate your heart landmarks. First we have, your aortic, your right second intercostal space, your pulmonic left second intercostal space, your herbs third intercostal space on the sternal border, your fourth, 4th intercostal space, tricuspid on the left sternal border, and your apical 5th midclavicular left intercostal space. And now I'm going to listen to all of these.
Okay.
And then we'll get you out here. Okay. All right. Okay, 1 more or 3 more. Herbs. Tricuspid. And apical. Everything sounds good. S1, S2 normal sounds. Thank you. So now I'm going to be assessing your peripheral vascular system. So I'm going to have you lie back and we're going to check your legs for some edema. Have you noticed any swelling or anything like that? Lift your pant leg here.
Okay.
Any swelling or anything like that?
No.
Any pain or aching?
No.
Any like coolness?
Mm-mm.
Okay, and the other leg. Okay. All right. Can you sit up again? Have you noticed any of that in your arms or upper body?
No.
So no coolness, no paleness, nothing like that?
Mm-mm.
Okay. No heavy feeling?
No.
Okay. Now I'm going to check all of your pulses. We have your temporal up here. Okay, good. Your carotid. Your other carotid. Your brachial. Your other brachial. Your radial. And ulnar. Your radial is nice and strong. Okay. Radial again. Your ulnar. Okay. Your apical. I'm going to flip your boob here again.
Okay.
Alright. Your femoral. Your other femoral. Your popliteal. Underneath the knee. Your other popliteal. Your posterior tibial, sorry. Your other posterior tibial. And then your dorsalis pedis pulses. All right, everything feels great. Thank you.
Mm-hmm.
Now I'm going to be doing the abdominal assessment. Are you okay with being in the sports bra?
Yes.
Do you feel like private, everything, nothing's open or anything like that, exposed?
No, we're good.
Okay. So first, can I have you lie back? Okay. Have you noticed any new moles or anything like that?
No.
Lesions?
Nope.
Scars?
No, nothing like that.
Changes in bowel movements?
No, everything's normal.
Constipation?
Nope.
Diarrhea?
Nope.
Any position that your body feels better in other than all around?
Uh-uh.
Okay. All right, so first, I'm going to start auscultating first, and then we're going to get into some palpation.
Okay.
So I'm going to start listening to vowel sounds in the right lower quadrant. Sorry, I'm going to go under your pants here.
Okay.
Okay. All right, your vowel sounds are normal, about 12 clicks. All right, now we're going to do some light palpation, then we're going to get a little deeper, and then rebound 10 minutes.
Okay.
Okay, so at any point, if I'm doing anything, let me know if anything hurts.
Okay.
Okay. Any tenderness or pain?
No, it feels fine.
Okay. No?
Nope.
Okay. No?
No.
Nothing?
No.
I see you have a belly button piercing. How long ago did you get that?
Maybe 3 years ago.
Any infections or any problems with it?
No, it healed perfectly.
Perfect. Okay, now we're gonna get into some deeper palpation.
Okay.
Let me know if anything hurts.
Okay. Nope.
Okay.
Nope.
Okay, your liver and spleen don't feel enlarged.
Nope.
Nothing? Last one.
No, we're good.
All right, so now we're gonna do rebound tenderness. So I want you to let me know if anything hurts more as I go in or as I come out.
Okay. It didn't hurt at all.
Okay.
Same thing, no pain.
Okay.
Nope. It didn't hurt.
Okay, perfect. So now I'm gonna check for kidney tenderness. Can I have you turn to the side?
Yes.
Okay, I'm gonna percuss on your back. Let me know if you feel anything.
No pain. Nope, we're all good.
Okay, perfect. Thank you.
Mm-hmm.
I'm going to be assessing your upper body musculoskeletal system. So can I have you stand for me? First, we're going to start with your neck. Can I have you look to the left? Can you look to the right? Thank you. Do you feel any pain when you do that?
No.
Can you shrug your shoulders for me? All right. Can you shrug your shoulders for me against resistance? Yes. All right. Do you feel any pain when I do any of this?
No.
Okay. So now we're going to move down to your elbows. Can I have you stick your arms out? And can I have you bend them in? Out. Okay. Can I have you flip? Back forward. Okay. Can I go ahead and have you go like this? Up and down, all the way behind you with your arms crossing. All right, can I have you stick your arms out to the sides and go up, behind your head, back down. Any pain doing any of that?
No.
Okay, let me palpate your elbows real quick. All right, so now I'm gonna have you tug against me. So go like this with your arms. All right, don't let me pull you out. Okay, ready? Go. There you go. All right, so arms back out, please. Can I have you flip your wrists? Great. Can I have you stick your hands up, your fingers up, flip your wrists back down, stick your hands down, wrists up. Great. Now we're going to check resistance with your fingers. So can I have you pull your fingers towards you? All right, towards you. Perfect. Any pain?
No.
All right, so now I'm going to palpate your wrist. Any pain or anything like that? Do you have a job where you have to type a lot or use your fingers a lot?
No.
Okay. This hand. No pain anywhere, no numbness in your fingers, no swelling, no nothing like that?
No.
Okay, perfect, thank you. All right, so now I'm gonna assess your musculoskeletal system again, but this time the lower extremities. So have you noticed any pain in your knees, joints?
No.
Muscle tightness, inability to straighten your legs in the morning? All right, can I have you lay back? I'm gonna start by palpating your hips.
Okay.
Let me know if you feel any pain or discomfort. Have you noticed any new problems, any difficulties in motion or anything like that?
No.
All right, we're gonna check your range of motion here. So can you move your hip out? We're gonna go out, back in, up, down. Can you bend your knee for me? Go in, out, in. All right, any difficulty in any of those motions?
No.
Okay, next leg, same thing. Out, in, up, down, knee bent, in, out. All right, so I'm gonna have you go against resistance now.
Okay.
So try and put your leg in. There you go. This leg in, okay. Push this one out. Push this one out. All right. Okay, we're gonna move down to your feet here.
Okay.
If you notice any pain in your feet or anything like that,
No.
I'm going to palpate all the bones, make sure everything feels normal. Okay, so can I have you bring your feet in, toes up, toes down. I'm going to separate your feet a little bit. Can you curl your toes in? Can you turn them out? Bring your ankles together. Perfect. All right, I'm going to have you move to the chair. I'm going to check your knees.
Okay.
Any pain in your knees?
No.
Any difficulty moving?
No.
Palpate everything. Feels normal. Okay, can I have you straighten your legs? Right, can you bend your legs? Okay. I want you to kick your legs out against resistance. All right. Try and bring your legs in against resistance. Okay, perfect. No pain?
No.
Thank you. All right, now I'm going to assess your spine. Can I have you stand? And before we get started, have you had any back surgeries?
No.
Back pain? Anything out of place?
No.
Okay, so we get behind you. Can you look down for me? All right, I'm going to palpate all of your spinous processes. Okay. No pain while doing any of this?
No.
Can you touch your toes for me? All right, nice concave shape. Can you stand back up? Everything looks good. All right, now we're gonna check your range of motion. Can I have you put your hands on your hips? All right, so now I want you to turn to the side without moving your hips. So,
Okay. Just the upper body?
Other side. Thank you. Any pain?
No.
Perfect. The last thing we're gonna assess is your gait and your symmetry. So can I have you stand for me?
Yes.
Can you hold out your arms to each side? It looks even. Have you ever noticed your hips off or any one leg longer than the other?
No.
Okay, so first I'm gonna have you walk straight on your tippy toes.
Tippy toes?
Yes. Perfect. Do you feel overly wobbly or anything like that?
No.
All right. And now can I have you walk on your heels? Same thing. Okay. Same thing. No over wobbliness?
No.
All right. And now we're gonna do heel to toe in a straight line. Yep. Perfect. Okay. Okay, so for the last assessment, I'm going to be checking your balance and equilibrium. Have you ever had dizzy spells?
No.
Fainting?
No.
Nausea and vomiting?
Mm-mm.
Ringing in your ears?
No.
Okay. So can I have you stand for me? We're going to do the Romberg test, which is going to test your balance. Can I have you put your feet together, close your eyes? Okay. All right, thank you. Have a seat. So that's everything for today. How do you feel? Any concerns?
No, I feel good.
Any questions?
No.
Okay, thank you so much.
Mm-hmm.